Hello, everyone, and welcome to this lecture on social connection and community in looking at our clients' whole person well being. This is Professor Kelsey Brown, Program Director for the Health and Wellbeing Coaching Program at San Diego Mesa College. And we are looking at this important topic today as it is another one of the areas that the NBHWC has highlighted as an important concept that they've added to the 2026 exam content outline update. Let's dive in. Today, we are going to look at the importance of social connection. What is it and why should we care for ourselves and our clients? We're going to look at what is being referred to as the modern epidemic of loneliness, what some of the metrics on loneliness are right now in the United States, some of the factors contributing to it, and some of the health impacts of these current levels of loneliness. And then we will finish by looking at the role of health coaches in social connection and loneliness. How can we emphasize, utilize, incorporate these important topics into our health and wellness coaching sessions? First, let's look at what social connection is. Social connection, as defined by the Centers for Disease Control, refers to having the number, quality, and variety of relationships that you want, and most importantly, feeling like you belong and have the support and care that you need. So, what does this tell us? This tells us that number, so the volume, the density, the amount of social connection you need, the quality being the depth, the support, the connectedness, and the variety or the types, meaning friend, family, partner, etc. An important note here is the number that you want. This might vary from individual to individual. Some people might like really wide and robust social networks, and some people might like really small but deep social networks. Both are okay. But the key here in having good social connection is that the amount and type and quality of your social relationships meet your particular wants and needs. And then keys to the quality of those social relationships are feelings of belonging and an adequate amount of support and care. And then Dr. Brene Brown, who is a researcher and social scientist who looks particularly at things like connection, belonging, shame, courage, etc., writes, connection is the energy that is between people when they feel seen, heard, and valued. So we know that all people are looking to feel seen, heard, and valued, known, and that is an integral part of the coaching process. That is one reason that coaching is so beneficial and that the listening and the presence aspects of coaching are so important because these are core needs for deep social connection. And as you'll see in today's lecture, we don't all have those in our lives. So when we can provide that deep feeling of being seen, heard, and valued in our coaching relationships, it helps open up our clients to greater health and well-being. Connection and belonging are core needs. These are not superfluous. These are not extras for people. It's not that we just need to get our exercise and our good food and our good sleep in and everything else is extra. These are actually core needs. And if we look at Maslow's hierarchy of needs, this is a motivational theory of psychology that researcher Abram Maslow, social psychologist, posited in the 1940s that explains human behavior based on trying to reach certain intrinsic human needs. This is what motivates people to behave certain ways to reach these basic human needs. And they start from physiological needs like food, rest, water, sex, safety needs like structure, a safe structure to live in, safety from danger and harm, exposure to weather events, physical safety, financial safety, etc. Love and belonging, ding, ding, ding. This is what we're looking at when we're talking about connection, deep connections, feelings of love and belonging, mutual care, reciprocal care between individuals and groups. Then we go on to feelings of esteem, self mastery, accomplishment, which we looked at when we covered spirituality, meaning, and purpose. And finally, the feelings of self actualization that some feelings of transcendence, moving beyond yourself, being connected to something greater than yourself, achieving deeper meaning and purpose, etc. We're really honing in on that middle layer here of love and belonging. And sometimes this pyramid is looked at linearly, where folks must first achieve physiological needs and health and safety needs before they could focus on love, belonging, esteem, connection, self actualization. And in some level, that's true. If you can't meet your basic needs for food, water, shelter, sleep, etc., you can't even worry about self esteem and self actualization. But at the same time, folks may be working to meet many of these needs at different levels throughout time and at the same time. And an important thing to know is that the need for love and connection are core biological needs built into our biology through evolution. How does this work? Natural selection has historically favored humans who are good at connecting, who have the strong ability to organize into groups and to partnerships, because, quite simply, historically, this has increased our odds of survival. When we lived in hunter gatherer groups, it was important to maintain strong social connections because you couldn't do all of the hunting, gathering, tending, caretaking, etc., all on your own. You needed different individuals to fulfill different needs. So this is why the need for connection, care, and belonging is rooted into our survival mechanisms and thus feels like a core fundamental need for psychological well-being and ultimately physical well-being as well. This begins at birth with our important attachment figures, often our parents. And this is when infants come out and they create initial bonds with parents where they feel attunements. Their parent can see them, they experience them, they're with them, they can sense when they are distressed, and generally meet those physiological and safety needs first, so then they can experience feelings of connection, love, belonging, etc. So this concept of connection and belonging is a core fundamental human need that is rooted in our biology throughout history and evolution and begins at birth, persisting through the lifespan. So we see first how important belonging and connection are before we explore where these things stand in our current modern society. Again, Dr. Brene Brown writes, true belonging doesn't require you to change who you are, it requires you to be who you are. I love that one because, again, if we're putting on a different front, if we're trying to act a way that is inauthentic to ourselves, acceptance that we get from others will not feel like true belonging. Only when we're able to be seen, heard, known, and valued as our true selves will we be able to experience true belonging. And again, this is why seeing our client as whole, resourceful, and capable, seeing them as competent and as having the ability to change, and as the full driver of behavior change in the coaching relationship is so important to their sense of true belonging and their ability to self actualize. Why does social connection matter to our health? Along it being a core biological need, what are some of the outcomes we see when we have strong social connections or when we don't? We see in research that high quality relationships help people buffer stress and generally improve health habits. It is shown to reduce cardiovascular disease, cognitive decline, depression, anxiety, and a meta analysis shows us that adults with strong social connection have a 50% increased likelihood of survival compared to those with low levels of social connection. This meta analysis is highlighted in the 2023 Surgeon General's report on loneliness and isolation, which we will cover shortly. So, what we're seeing here is that good, strong social connection reduces our risk of psychological dysfunction, it reduces our risk of physical ailments, and it increases our general odds of survival because of these factors. So, what are these specific factors that shape social connection? How exactly does social connection impact our well being? We can look here at a modified version of the social ecological model, which we'll reflect on again in a moment, to see how social connection impacts the individual levels, our relational level, community, and society. So, On the individual level, things like chronic disease, sensory and functional impairments, our current state of mental and physical health, our personality or temperament, and even things like our race, gender, sexuality, socioeconomic status, and life stage will influence our social connection. The ease with which we are able to connect socially, to make and maintain strong social connections. An example would be that robust mental and physical health, strong physical and mental health would make it easier to make strong social connections, and poor mental or physical health might make that harder. Similarly, a chronic disease that makes it difficult to perform activities of daily living or to walk, ambulate long distances might make it harder to make social connections, or potentially psychological mental health conditions like something like generalized anxiety disorder or social anxiety may make it more difficult to make social connections. Other factors looking now at the relationships level, the structure, function, and quality of your relationships will, of course, impact your social connections. So, how well they work, the depth of them, the number of them you have, with whom you have relationships, your household size. Do you live alone? Do you live with one other person? Do you live with a group of people? How well do you all get along? The characteristics and behaviors of close others, your feelings of empathy, and those with whom you are in relation. In your community, the outdoor space around you, the housing network, the schools and workplaces around you, local government, businesses, community organizations, healthcare, public transit, etc. An example would be the neighborhood that I live in has an amazing community park, public park, big grass field, big playground. And I, because of this, know a ton of people in my neighborhood that I would not otherwise know. And then when my daughter started kindergarten at her school in the neighborhood, she already knew a ton of the local kids because of this community space. So, this is a way that our community space, our built infrastructure, has impacted our social connection. If we take a broader look out now at the societal level, we can see societal norms and values, public policies, our technology use, civic engagement, democratic norms, historical inequities. An example here would be the norms and values around tech use. So if you are in line at a grocery store, if you are on a public bus, if you are at the playground, is everyone on, if you are walking around campus, is everyone heads down on their cell phone, headphones in, or is there a community or a space where people are engaging with folks around them? A simple example would be self checkout versus checking out with a human being at the register. Those create opportunities or lack thereof for social connection. So these are simply examples of different factors, different levels that impact our social connection. We can also look at this through the lens of the social ecological model. You will see in Health 107, you may have looked at this already. The social ecological model highlights different levels that can impact our well being and our clients' well being, all the way from the individual to public policy. So, that previous example highlighted different ways through the individual, interpersonal, organizational slash community, and public policy levels of the social ecological model, different factors that may either make it easier to make strong social connections or harder to make strong social connections. And as you will see, or as you have reviewed in the social determinants of health information in Health 107, that some of these things are within our control, largely the individual level and sometimes the interpersonal level. Our own knowledge, skills, attitudes, beliefs are sometimes within our individual control. So, for example, if you find going out in crowds or groups very nerve wracking, you could perhaps find different ways to seek out social connections, maybe a book club, or maybe a cycling club, or maybe a joining a social media or a friendship networking app, etc. That doesn't have to be big ways to make connection. And for better or worse, we can't always impact things like our organizations, our communities, our public policy norms, though we can do things like vote, like contribute to the norms that we want to take place in our communities and our organizations. We can talk to leadership. We can talk to governing boards to try to create opportunities for the norms that we wish to see. Again, the neighborhood that I live in, I feel very lucky. There's a community organization. So they plan things at this park, like concerts in the park and movies in the park. And again, these are other opportunities at the organizational and community level that bring people together. So we're highlighting the social ecological model and these factors that shape social connection as a way to sort of pan out and say, okay, the social connectedness that your clients or you might feel is not all up to you. If your client is expressing or experiencing low levels of social connection, it's not because, oh, your client is not putting in effort to make strong social connections. There are myriad factors that will impact their perception of and their lived experience of and their actual levels of social connection. So some of them we may be able to find and collaborate on action plans around, and some of them we may simply need to acknowledge and accept and find alternative strategies for. Looking at a model of how social connection influences our health, this again is from the US Surgeon General's report on loneliness and social isolation that they put out in 2023. And this is looking at okay, we understand that social connection and lack of social connection does influence our health and well being. We saw the data on how it reduces cognitive decline, cardiovascular disease, improves lifespan and health span to have strong social connections. We saw that this is a biological need, but how exactly does this happen? So, this theory suggests that social connection influence our health through three pathways: biological, psychological, and behavioral. And the ideas here are that our social connection can influence our actual internal biology through stress hormones. If we have stronger social connections, we have a more blunted cortisol response in the face of stressors. We may have more or less inflammation depending on our social connection and support, such that if we have low levels of social connection and support, we see greater levels of systemic inflammation. And this may even alter our gene expression through a concept known as epigenetics. So certain behaviors can trigger or turn on genetic expression, and certain behaviors can trigger or turn off genetic expression. So these are biological mechanisms through which social connection may impact our health. Psychological. Social connection can impact our meaning and our purpose. Having strong social ties may help us feel that we are connected to something bigger than ourselves and that we have an impact on something bigger than ourselves. And we know through positive psychology research that this is very good for our well being. It can impact our feelings of stress, safety, resilience, hopefulness, comfort, care, etc. And lastly, it can impact our behaviors. The norms of our social groups can impact our physical activity levels, our eating habits, the amount of sleep we get, our substance use habits, our treatment habits, etc. So if you engage in a group of people that generally likes to eat pretty healthy and you like to do physical activities together, you like to hike or take classes or go to bed at reasonable times, that is going to have a certain impact on your health versus if your friend group likes to stay up really late, likes to consume many substances, does not engage in regular physical activity, and tends towards less nutritious foods. Those things will have an impact on health. And you can see it's not just any one of these things, it's the combination of these things that impacts health outcomes such as cardiovascular disease, diabetes, all cause mortality, psychological well-being, etc. So this diagram explains how and why social connection has the health impacts that it does. Pivoting now to look at the blue zones. I've brought this up in a couple other lectures for you all. The blue zones are the areas of the world that have the highest number of centenarians. Centenarians is a fancy word for people who live to 100 and beyond. So these are the areas of the world that are shown to have a lot of very old, generally healthy people. There are 5 blue zones. You can see them depicted here. one in the United States, the rest throughout the world, Costa Rica, Greece, Italy, and Japan. And when they found these blue zones, they studied them to see what habits, behaviors, beliefs, factors were consistent among these groups that may explain the reason they have a lot of very healthy old people. And they found generally 9 habits or concepts that were consistent across these groups that they call the Power Nine. And three of the nine, a full one third, correspond to social connection. These are prioritizing loved ones. They find that folks in these areas tend to have strong relationships, strong familial relationships, and prioritize connection with loved ones. Many folks in these areas have multi generational households, meaning that grandparents, parents, and children are often living in the same house. Many of these areas, the individuals belong to strong faith based groups. Again, these faiths are different. They are not all the same. So it's not the specific religion or deity that makes the difference here. It is the concept of connection through something bigger than oneself with similar others and a space that people regularly get together to commune and connect. They also find that all of these areas have the practice of cultivating strong, healthy social networks. So, connection is an important thing. Friendship connection is an important thing in addition to familial and faith based connection here. So, you can see that again, 3 of the 9 concepts from the blue zones respond to some form of deep, meaningful connection. This highlights again the fact that social connection and support are important for both psychological and physical well being. Now we're going to take a turn to look at what many are referring to as the silent epidemic of loneliness, both in the United States and throughout the world. In 2023, the US Surgeon General put out a report called Our Epidemic of Loneliness and Social Isolation. And in this report, you could see 2023 shortly after sort of the apex of the 2019, 2020 coronavirus, they said that half of Americans, 50%, report feeling measurable levels of loneliness on a regular basis. So half of Americans are feeling some quantifiable measure of loneliness regularly. And in this report, they not only identify that many of us are feeling lonely, meaning we don't have the quality, the depth, the breadth, the variety of social connections that we desire, but they also show that loneliness causes systemic inflammation. So, this would be chronic low grade activation of the immune system that negatively impacts well being, comparable to that which we see through physical inactivity, obesity, or smoking 15 cigarettes a day. Now, this stat blows my mind. And similarly, it has blown the mind of many of my students who said, where did they get this data? So I looked into it and they found this data from a meta analysis that showed the impact on mortality from loneliness. And they found that this level of increased mortality based on loneliness was similar to the level of increased mortality as that of smoking 15 cigarettes a day. So, yes, it's a very punchy headline. And that is how they gathered and are expressing this data. And then we also again see that loneliness increases the risk of depression, anxiety, heart disease, dementia, stroke, and all cause mortality, meaning that again, those who experience high levels of loneliness have a greater likelihood of dying in the near future than those who do not. And we see that folks who are experiencing strong social connection have a 50% lower odds of dying than those who are experiencing low levels of social connection. So, yes, we can see according to the US Surgeon General's report, many Americans are feeling lonely and it is having a negative impact on our health. And often, the difficult part about this is that it's silent. Folks don't know who to share this with because that is part of the problem. They don't necessarily feel they have someone to share this with. So it is often going unspoken. And the worst part of suffering, oftentimes for folks, is feeling alone in that suffering. And because not many people are sharing this, oftentimes many folks may think that they are the only ones feeling this way, when we can see by this data that that is not the case. So, what can health coaches do with this information? Certainly, we can't change all of the levels of the socio-ecological model to make it so that we have a robust, well-connected, thriving social society. But let's explore a couple things we can do, remembering that no person exists in a vacuum. We cannot solely focus on our clients' personal, individual, private health behaviors and expect them to be well if they don't have strong social ties. So, a couple things we could do. If our clients are experiencing and expressing social isolation, loneliness, lack of strong social ties, we can tell them that they are not alone. We could share this data with them and tell them that it is not their fault. This is not all coming from individual level behaviors, activities, etc., that there are societal, structural, relational, organizational, and community level factors that are increasing levels of social disconnection in the modern world. And they're not alone in experiencing this. Just that can often be a salve for difficult feelings. We can explore client social landscapes in our intake sessions or in our exploration sessions, in our intake paperwork, in addition to asking whatever we may ask or explore around areas that they may want to focus on, other lifestyle factors such as eating habits, exercise, and sleep. We can explore their social landscape, inquiring about the depth of their social connections, their their strong support networks, etc. And if these are areas that clients want to work on, if they identify feelings of loneliness or social isolation, and they say that developing stronger social connections is important to them, we can work with them to collaborate and create action plans that are meaningful, specific, and relevant to our client around improving the depth, variety, or breadth of their social connection. So think of these things as you move on and as you continue your exploration and your work with clients, remembering that no client exists in a vacuum. That if you are feeling feelings of loneliness or isolation, or your clients are feeling these sensations of loneliness or isolation, you are not alone. They are not alone. Unfortunately, many of us are experiencing this right now in our modern, technologically driven world, but with a focus on social connection, if relevant, and action plans designed around deepening or increasing social connection, we can infuse this into the work we're doing with clients and improve their well being.